Let's continue our discussion on visual diagnosis inspection. Still on body movements, let's talk about paralysis. In the limbs and body, paralysis is called Tan Huan in Chinese, which can be written in two different sets of characters. The second one of which means spread out and relaxed. Observation. In paralysis, a weakness of the muscles of the forelimbs impedes the proper function of the legs and or arms. Paralysis is seen only in chronic, protracted conditions and is usually, but not always, accompanied by flaccidity of the muscles, in which case, in Chinese medicine, it pertains to the disease category of atrophy or the Wei syndrome. In mild cases, paralysis consists in a weakness of the arms and legs, which creates a slowness of movement, while in severe cases, movement of the arms and or legs is severely impaired or completely impossible, and the patient is confined to a wheelchair. In Western medicine, this type of paralysis is frequently seen in spinal injuries or neurological diseases, such as multiple sclerosis or motor-neurone disease. Clinical significance. Paralysis may be due to many different patterns depending on the severity of the disease. Generally speaking, in the beginning stages of paralysis, there may be invasion of external dampness occurring against a background of deficiency. In the later stages, paralysis is often due to general deficiency of qi and blood, and in particular, a deficiency of stomach and spleen, which becomes unable to transport qi to the limbs. In yet later stages, the main pattern emerging in paralysis is a deficiency of liver and kidneys, which may manifest with yin or yang deficiency. At such a stage, the condition is complicated by the possible development of the pathogenic factors, such as internal wind, which may cause spasticity of the limbs, blood stasis, which may cause pain in the limbs, or phlegm, which may cause numbness of the limbs. In acute febrile diseases, which progress to the blood level, yin deficiency may develop, leading to the severe malnourishment of the channels and therefore to paralysis. This is, for example, the pathology of the paralysis deriving from poliomyelitis. Of course, paralysis deriving from a spinal injury is different, and it is due to external trauma and does not fall under any of the patterns mentioned earlier. However, in a patient suffering from a paralysis from spinal injury, this condition itself will, in time, lead to a deficiency of stomach and spleen. Multiple sclerosis is an example of paralysis that is commonly seen in Western industrialized countries, and one can identify clearly the patterns in its pathological development. There are 4 stages in pathological progression of multiple sclerosis. The very beginning stage is characterized by invasion of external dampness, and the symptoms are purely numbness and tingling. The second stage is characterized by deficiency of the stomach and spleen, and at this stage, the patient begins to experience a difficulty in walking. The third stage is characterized by deficiency of liver and kidneys, which fail to nourish the sinews and bones, and the patient experiences severe difficulty in walking and urinary incontinence deriving from the kidney deficiency. The fourth stage is characterized by the development of pathogenic factors, which may be internal wind itself deriving from the liver and kidney deficiency and causing spasticity to the limbs, or blood stasis causing pain in the limbs. So to summarize, the 4 stages of multiple sclerosis are as follows. First, dampness, manifesting with numbness and tingling. Second, stomach and spleen deficiency, which will manifest with difficulty in walking. The third stage is liver and kidneys deficiency, where there is severe difficulty in walking and urinary incontinence. And the fourth stage, the development of pathogenic factors, which is possibly internal wind with spasticity of the limbs or blood stasis with pain in the limbs. Here we have points for the 4 stages of multiple sclerosis. In dampness, we may use REN9, REN12, REN5, spleen 9, and bladder 22. For stomach and spleen deficiency, we may use REN12, stomach 36, bladder 20, and bladder 21. For liver and kidney deficiency, we may use liver 8, kidney 3, REN4, bladder 23, and bladder 18. In the development of pathogenic factors, where there is internal wind, we may use liver 3, gallbladder 20, DO16, and GB31. And for blood stasis, you can use spleen 10 and bladders 17. In addition to the points in the previous clinical note, one must also treat the channels with points similar to the ones used for painful obstruction syndrome as follows. For the arm, we can use LI10, triple burner 6, LI11, LI15. For the leg, we could use stomach 31, gallbladder 31, stomach 34, stomach 36, and stomach 41. Here we have to note that stomach 41 is an important point as it helps the patient to lift the feet better as they walk. In multiple sclerosis, there is often a difficult lift of the feet, which makes walking very difficult. So let's discuss further the patterns leading to this condition. So in an empty pattern where there is stomach and spleen deficiency, this will manifest with paralysis, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, uncomfortable feeling in the epigastrium, lack of taste sensation, pale tongue, and an empty pulse. In neurological problems, such as multiple sclerosis, this pattern corresponds to the condition's middle stage. So treating with acupuncture, we can use REN12, stomach 36, spleen 6, stomach 31, and LI10. For liver and kidney yin deficiency, this is a long-term paralysis with slow onset, manifesting also with weak limbs, weak knees, dizziness, tinnitus, hardness of hearing, low back ache, dull occipital or vertical headache, insomnia, numbness or tingling of the limbs, dry eyes, blurred vision, dry throat in the evening, dry hair and skin, brittle nails, night sweating, dry stools, scanty menstruation or amenorrhea, normal colored tongue without coating, a floating and empty pulse. In neurological problems, such as multiple sclerosis, this pattern corresponds to the condition's late stage. In treating with acupuncture, we can use liver 8, kidney 10, kidney 3, REN4, gallbladder 34, stomach 31, and LI10. Next, we have here a combination of empty and full pattern. First, we have liver and kidney yin deficiency with internal wind. This is a long-term paralysis with slow onset, manifesting also with tremors or spasms of the limbs, weak knees, numbness or tingling of the limbs, lower back ache, dizziness, tinnitus, hardness of hearing, dull occipital or vertical headache, insomnia, dry eyes, blurred vision, dry throat in the evening, dry hair and skin, brittle nails, night sweating, dry stools, scanty menstruation or amenorrhea, normal color, deviated or moving tongue without coating, and a floating, empty, and slightly wiry pulse. In neurological problems such as multiple sclerosis, this pattern corresponds to the condition's final stage. In treating with acupuncture, we can use liver 8, kidney 10, kidney 3, gallbladder 34, stomach 31, LI 10, liver 3, gallbladder 20, do 16, SI 3, with bladder 62. For kidney yang deficiency, there's paralysis with low backache, cold and weak knees, feeling cold, bright white complexion, tiredness, lassitude, abundant clear urination, urination at night, impotence, decreased libido, pale and wet tongue, and a deep, weak pulse. In Qi and blood deficiency, there is paralysis of the four limbs and body, weak limbs, poor appetite, loose stools, weak voice, tiredness, blurred vision, dizziness, numbness or tingling of limbs, palpitation, dull pale complexion, pale tongue, weak or choppy pulse. In liver blood stasis, there would be paralysis, stabbing pain in the joints, hypochondrial pain, abdominal pain, painful periods, menstrual blood, dark and clotted, masses in the abdomen, purple nails and lips, purple or dark complexion, a purple tongue, and a wiry or firm pulse. In cold dampness, there will be paralysis with a feeling of heaviness of the limbs, numbness, edema of the limbs, epigastric fullness, a feeling of heaviness of the head and body, feeling cold, cold limbs, a sticky white tongue coating, a slippery, slow pulse. In neurological problems such as multiple sclerosis, this corresponds to the condition's initial stage. In damp heat, there will be paralysis of the lower limbs, hot limbs, feeling of heaviness of the limbs, numbness of the limbs, epigastric fullness, sticky taste, thirst with no desire to drink, feeling of heaviness of the head and body, feeling of heat, sticky yellow tongue coating, and a slippery, rapid pulse. In liver qi stagnation and liver blood deficiency, paralysis will come with numbness or tingling of limbs, hypochondrial or epigastric distension, irritability, moodiness, feeling of lump in the throat, premenstrual tension, dizziness, blurred vision, floaters, scanty menstruation, dull pain complexion, a pale tongue, and a choppy or fine and slightly wiry pulse. In stomach and spleen fluids injured, there is paralysis with sudden onset after a febrile disease, a weak limbs, hand cannot grasp, dry skin and mouth. This pattern corresponds to the aftermath of a febrile disease such as polio. So to summarize, paralysis can be due to invasion of external dampness, manifesting with slight weakness of the limbs and feeling of heaviness. It can also be due to deficiency of qi and blood, particularly of the stomach and spleen, where there is weakness of limbs and difficulty in walking. And finally, it can also be due to deficiency of liver and kidneys, where there is severe difficulty in walking. Thank you for your attention.